Hello again, it's Dr. Walker from dentalwalker.com. Welcome back to the channel. Today I want to talk a little about really two things. One is fluoride, and I've talked about fluoride in the past in terms of the reasons that we don't need fluoride. And the other one I'll talk about today is iodine, the reason that we need iodine. In fact, lots and lots of iodine. So when you go to the dentist, one of the few things, or one of the first things I'll mention to you is about fluoride and fluoride treatment, and how it helps your teeth enamel, and it gives you strong bone and prevent cavities and those kind of things. But it's all about the teeth in that regard, right? It's all about the teeth. On the other hand, iodine. Iodine is one of those things that is required or needed by almost every cell of the body. Almost every cell in the body, you need some degree of iodine. And a lot of folks will tell you, and I've talked also about not eating or having table salt. A lot of folks will tell you, oh, well, I need table salt to have my iodine in it because it has iodine in it. And really about only 10% of the iodine that you need for your system, for your body, is actually in table salt. And table salt, I mentioned before, they have essentially removed all of the trace elements from table salt. They quote added iodine to it. Again, it's a very little bit of iodine, and then again they stripped all of the rest of the elements out of the table salt, and really that's it. So it's table salt and iodine. But the problem I have with table salt, again, not just that it strips all of the sort of the basic nutrients in the sea salt, but they've added then what we call an anti-caking agent, which is ferric cyanide typically, and essentially that is supposed to help it prevent it from clumping and so forth. So that's the reason they've done that. But again, the whole point is that it's still ferric cyanide. The second part of that word is the cyanide. So I do not like table salt for that reason. I like Himalayan salt or Celtic salt, probably more Celtic salt than Himalayan salt. That's another conversation to be had. Anyway, back to the iodine. Back to the iodine and fluoride. So as I said before, fluoride is needed really for your teeth, right? For your teeth enamel is what they tell you, and whatever. But iodine again is needed by essentially every cell of the body. And here's the problem with those two things. Now, fluoride is in almost just so many things, right? It's in your toothpaste, in your mouthwash, in your drinking water, right? And you're doing that several times a day. You're having some water. Either you cook your food in your water, or you go out to lunch and you have a drink that has tap water in it. Tap water has fluoride, or you're washing your food in fluorinated water, or you're cooking fluorinated water, right? You have so many different ways of getting fluoride into your body. Now think of iodine. Now iodine, you get iodine mostly. From my standpoint, mostly through seafood, crustaceans like crab and shellfish, and even blueberries you get, or green bananas you get some degree of iodine from. But think about the last time you had some green bananas, and think about the last time you had some sweet potatoes, another good source of iodine. Or how often do you have seafood, shellfish, for example? How often do you do any of those things, right? And then think about how many times you brush your teeth per day, and how many times you drink some fluorinated water, or all of those things, right? Problem, right? So you have very little iodine coming into your body, but you have lots and lots and lots and lots of ways to get fluoride in the body. What is the problem with that? So fluoride is, again, as I told you before, needed for every cell of the body. Now, if you do not have enough iodine in your system, but you have an abundance of fluoride, they're both in that same category on the periodic table. They're both halogens. And in that, they sort of match the same receptors in the body, one versus the next. They match sort of the same receptors. So if you have a whole lot of fluoride and you have very little iodine, the fluoride then tends to outcompete the iodine in your system. So now you have, let's say you have 100 molecules of, and it just became simple, you have 100 molecules of fluoride, but you only have 1 or 2 molecules of iodine, and you're both competing for the same receptor. Which do you think is going to win, right? It's a math game at that point. It's a numbers game at that point. So you have all of this fluoride outcompeting the iodine for the same receptor. So over time, what's going to win? It's going to be that fluoride. Now, maybe the first 5, 10, 15 years of your life is not a problem, right? But as you get older, and it's been doing this thing, it's been outcompeting the iodine in the system for so many years, your system begins to give way, right? And as I told someone today, it's the body will try to compensate as best as it can long term until it can't do that anymore, right? That's what's going to happen. It's going to try as best as it can to kind of keep your receptors clean and have your iodine doing the activation it needs to do, kind of keep your system going. But at some point you get to 40, 45, 50, 55 years old, it can't keep doing that, right? So you end up with things like diabetes, and end up with things like osteoporosis, end up with insomnia and lack of sleep and lack of focus and lack of drive, right? All of those things which iodine tend to do. A lack of energy is another one, right? It tends to then begins to give way because fluoride is just outcompeting it for so many years, and it's now just sort of giving up. And a lot of people will complain in their, obviously in their 40s and 50s, as I said before, about those things. We'll begin to complain of things like insomnia, or lack of focus, or lack of drive, or lack of just fatigued all the time. And one of the main reasons that could be, again, is because of lack of iodine in the system. And I think it's, I hate to use the word intentional, but right, it eventually you'll become sick. And when you're sick, they'll have a pill for you. And once you get that diagnosis of hypothyroidism or big, or something, people will get these massive thyroid gland called goiters, right? And they're pretty big. Essentially, where you're having chronic lacking iodine in some instances, or hypothyroidism in some instances, and naturally diabetes and obesity and just all these things that happen because you have chronically low iodine, right? Now, I recommend still to reduce your fluoride intake as best as you can, right? And that includes tap water. It should be gone, right? Tap water. There's so many also so many ways of getting your toothpaste, for example, that will not have or will not contain fluoride. Mouthwash should be an absolute no because it has so much fluoride, for example, in it. And I'll tell you one other thing. Sometimes, in some agencies, for example, I believe the CDC will sort of make a broad recommendation, and they'll have like 0.7 milligrams per liter of water. That's how much fluoride it'll actually add to their thing. But there's some agencies and in some states where that same number could be 4 milligrams per liter. So right, so you have 0.7 milligram per liter of fluoride in some places, and in other places you'll have 4 milligrams. That's a whole lot more iodine in your drinking water, right? And again, you don't need it, right? You do not need. The dentist will tell you, oh yes, it keeps your teeth in, sure, right? But you don't need it for anything else in the system. Your body needs iodine, needs lots of iodine, and not much in terms of fluoride. So again, my point to you is reduce your tap water as best as you can. Reduce your foods, like processed foods, for example. Lots of fluoride, for example, in the processed foods, canned foods, any of those things will have lots of fluoride in. Obviously, the toothpaste I mentioned before, the tap water. If you can't, I mean, just look it up. I'll add a list of things that has high amounts of fluoride in it. Reduce those as best as you can, right? And then increase your foods that contain lots of iodine. For example, as I said before, shellfish, for any of the shellfish will do that. Seaweed, blueberries, green bananas, sweet potatoes, all those things, foods have very good amount of iodine in this, which is what you need. And then the last thing is, if you've done that for a couple of months and you're still not feeling well, and again, these are typically people that have sort of low iodine levels, and in some countries, like I think Australia, for example, almost 40% or more of the people are diagnosed with hypothyroidism. And in the US, probably about 30% of people with hypothyroidism. Surprised it's not more than that, but that's what it is. It's about 30% in the US diagnostic or diagnosed with some degree of hypothyroidism, right? And again, it's partly because of all this tap water and this, fluorinated toothpaste and mouthwash. All of those things, again, tend to make the situation worse. I'll add a list of things that you can use to increase your iodine levels, and things you should also remove from your diet that has high fluoride levels in it. And again, they both compete. They're both halogens. They both compete for the same receptors, except one of them you need iodine. The other one you don't need, right? And then the other thing that people tend to do, and I've not done that myself, but people tend to do that as well, especially when they have low iodine in their system, is Lugol solution. They will take a droplet of Lugol solution, add that to a glass of water a couple times a week, just one drop typically, and do it that way. There's other folks that have ways to sort of cleanse the body of fluoride. You can look those up online. If I find one, I'll send it to you. But there are lots of places that talk about how to reduce your fluoride in your system and increase activation of things like iodine in your body. And again, iodine is needed, fluoride's not. Anyway, thanks for listening. Dr. Walker, God bless.